sgmd. It's important to not take anything personally in medicine and life. When it comes to procedural services, it's important to not take it personally. It's important to think, certainly I'm biased towards IR, but I realize that we exist in a marketplace, right? And the marketplace has options. And that's a good thing. It's a good thing when the marketplace is diverse. It's better for the consumer, right? If I want to go buy groceries in this area, I can go to Walmart, I can go to Tops, I could drive out a bit further, I can go to Wegmans, I can go to Sam's Club, right? I have different options, all right? There is a marketplace, and same thing to understand with procedural services in a hospital setting. There is a marketplace. I think, again, I'm biased, I think IR is usually the best option in the marketplace, but it exists within the marketplace. IR is the most effective and efficient clearinghouse for procedures in the inpatient setting. But again, I don't take anything personally. A lot of different services that can do procedures, right? There's general surgery. There's ICU medicine, right? There's pulmonology. There are residents. Residents are interested in procedures. Residents can perform procedures. All right. There's ER physicians. All right. There's surgical subspecialists, right? These surgical subspecialists, highly trained individuals, very intelligent. They can learn procedures, right? The procedures nobody owns. Just because IR can do them doesn't mean that other services can't learn them. They can learn them. They can provide them. They can cut us out. That's fine. That is their prerogative. Again, we compete in a marketplace for procedures. Why does IR still exist? IR exists because we are at the top of the market when it comes to procedures. We can do them the fastest. We can do them the safest. We can manage our own complications, right? Take for example, thoracentesis. Pretty simple procedure if you think about it, right? A lot of different services can do it. An intern can theoretically do it. A surgeon could do it. A ER physician, an intensivist, a pulmonologist could do it. It ends up being IR typically does it. It ends up being that we can often do it the fastest, right? We're 100% procedural services. We're not seeing some patients in inpatient setting, managing critical care and then doing procedures. We're sort of just doing procedures all day. So if we have to add on a thora, that's no big deal. We can do it bedside. We can do it very safely. We have ultrasound imaging. We'll make it pretty straightforward. We know where we're trying to go, and we, hit the mark in one shot. We can manage the complications, right? I mean, again, this unfortunately does happen from time to time, but you might hit a bleeding artery for a thora, all right? If an intern, again, this could happen, it's very low likelihood, but let's say it happened, right? An intern goes to do a thoracentesis. They don't go above the rib. They hit an intercostal vessel. It starts bleeding. The patient's in hemorrhagic shock. What do you do? Well, IR knows what to do with it. We can medically manage it and then get them on the table and then procedurally manage that vessel, that artery. We know how to do angiography, non-selective and selective. We know we can get a microcatheter out to that vessel and embolize it and close it and end it. So again, we provide the full spectrum of services. And that's what it comes down to. We are a full service procedural specialty. It's what we're good at. We're at the top of the market. We're like the Walmart. In this area, if you really want groceries, you go to Walmart. Well, if you're in the hospital and you need a procedure done efficiently, safely, effectively, with post-procedural management, you contact IR. That's just the way it is, and that's the way it's going to be. Again, don't take nothing personal. We operate in the market. Put yourself at the top of that market. That's your prerogative. sgmd.